Welcome, everyone. My name is Dawn DeCuna. Welcome to Open Minds Expo. Thank you so much for coming. And I really appreciate John for creating this opportunity for those of us that are psychedelically curious to come together and learn a little bit about these life-transforming medicines. My name is Dawn DeCuna. I'm a psychologist. I'm here in Toronto. And we have a ketamine clinic, a ketamine-assisted psychotherapy clinic. Oh, it is working. Okay, here we go. So I'm going to talk a little bit about ketamine-assisted psychotherapy. It's what we do, and it's pretty focused on just ketamine and not all the other psychedelics that are so very, very important. So this is an overview. I'm going to talk a little bit about the difference between ketamine therapy, which is medical applications of ketamine, and psychotherapeutic applications of ketamine, which are quite different. A little bit about myths and truths about ketamine and how ketamine works in ketamine-assisted psychotherapy. And what else am I going to talk about? How to journey safely. That's very, very important. The importance of setting, and integration, and our particular signature, which is the self-care and aftercare that we provide. So as I said, my name is Dawn DeCuna. I'm a clinical psychologist, educational psychologist. I did my undergraduate work at the University of Guelph. I did 2 graduate degrees at the University of Toronto, 2015, and I had a pretty regular practice for a couple of decades, pretty normal life as a psychologist. And then in 2015, I had a catastrophic event that I had no place to go but in. So retrospectively, I would say it was my calling. And so that's what I did. I went to Mexico and I woke myself up. And the next year I went to California and studied psychedelic medicine for a whole year. And then when I came back, psychedelic research was just starting up in Toronto. I trained with Compass Pathways in Helsinki, in Washington, in New York, and San Francisco. So a lot of training, and then here at CAMH as well. The first historic study approved by Health Canada for psilocybin and treatment-resistant depression. So that's what I'm all about. And then founded BTT. So in terms of the medical applications of ketamine, so ketamine is a completely synthetic drug, unlike the plant medicines. It is called a dissociative anesthetic, and it has hallucinogenic effects, which is why we use it. So ketamine is provided in medical clinics or hospital settings. It's usually provided via IV or IM, intravenous or intramuscular. We don't do that at our clinic. We use oral lozenges that are compounded for us by our pharmacist. And that's the difference between the medical and the psychological applications. IV-IM is provided by anesthetists, psychiatrists, and nurse practitioners for the most part. The indications for ketamine therapy, very, very successful for pain syndromes, and it has recently been approved for psychiatrists for treatment-resistant depression. Some of you may be familiar with Spravato. So actually, ketamine is a molecule that cannot be patented, and so what Spravato did is they patented the delivery system, so it is now used for treatment-resistant depression. So ketamine has some very interesting properties. It is a neuroprotective agent. It has anti-inflammatory and very rapid-acting antidepressant effects. It would be unusual to find psychotherapy to go along with medical ketamine, so it's a different model. So this is a pretty busy slide. Oh, I am so sorry. So yeah, maybe I'll just look at this. John, can I turn this on? Can you hear me with this if I use this? Oh, okay, excellent. Okay, so I think this is easier. So the indications for pain, treatment-resistant depression, neuroprotective properties, anti-inflammatory and antidepressant properties is becoming very popular. It's being offered through many of the hospitals in Toronto. UHN, Toronto Western, and St. Mike's in particular are doing a lot of research in ketamine right now. And as I said, there's typically no psychotherapy involved with it. It is a medical procedure. So this slide, I really want you to pay attention to when it comes to ketamine is that it has properties in the brain. It blocks a neurotransmitter and it activates another neurotransmitter. And these compounds are very helpful in memory, mood, learning, all kinds of very interesting downstream effects ketamine has in medical doses. The most important thing you want to know about ketamine is that it promotes plasticity. Plasticity, I'm sure most of you know, really has to do with the growth of the dendrites on a neuron. And what that means is that dendrites that don't normally speak to one another are able to speak with one another. And that, I believe, is probably the mechanism that explains the insights that occur with ketamine. I can tell you I'm very devoted to plant medicines, and I only became interested in ketamine after I learned a lot about it. I have to admit I had a bias because it's synthetic, and I don't like synthetic things. I just don't like them. But I have changed my mind about ketamine. Please. Please go ahead, ask a question. It contributes to the growth of dendrites. I'm not aware of increase in density of gray matter. But ketamine does work in cortical areas of the brain. So I think you would have to do ketamine for a while to actually see growth in gray matter. But you're quite right. The dendrites are in the gray matter, and that, I think, is what contributes to the insights that we have. There are structural changes that occur in the brain. So one of the things that ketamine does is as it downregulates some chemicals in your brain, it shuts down or dampens the default mode network. Can anyone, can I have a show of hands? Who does not know what the default mode network is? Okay, so thank you. The default mode network is that neural activity in your brain that is going on all the time, all the time, all the time. This is where your inner critic lives. This is where your inner judge lives. This is where all your shame lives, your anger, and all that stuff lives in the default mode network. It's just going on constantly. So the ketamine dampens that down so that you can hear other voices in your consciousness that you have not spoken to for a very long time, like the experiences like joy and curiosity and happiness and those kinds of things that really get dampened down in us as we grow. So that's really the thing that I want you to see in this slide. And as a result of the dampening of the default mode network, it creates a portal into your non-conscious mind. So there's 3 layers or levels of consciousness that I work with. So there's ordinary consciousness, that's the state we're in now, it's beta. And then there's subconscious. Subconscious are things that are going on in your body all the time, but you can bring them to conscious awareness if you choose. For example, blinking, that happens all the time. Swallowing, it happens all the time. Breathing happens all the time, but you can bring your attention to it if you want. And then there's stuff that's just completely non-conscious. You can't get to it, not even with psychotherapy. I've been a therapist 33 years, just can't get there. That's just the bottom line from my point of view. You need the medicine to open that portal. That's how we get into non-conscious material. So the psychological applications are ketamine. We use off-label. Off-label means that Health Canada has not approved this medicine for the use that practitioners use it for. So ketamine is an anesthetic. It is approved by Health Canada and the FDA for the use of anesthesia. Psychiatrists, pain specialists, and now psychologists will use it in very, very low doses off-label. So you need to know Health Canada is not approving it for psychotherapy. They're not objecting particularly, but it wasn't designed for psychotherapeutic purposes, and that's what off-label use means. So psychiatrists, anesthetists will prescribe it, family doctors, nurse practitioners will prescribe it for off-label use, and it's brilliant. It's just a brilliant, brilliant medication now. So the indications that we use it for are post-traumatic stress, complex PTSD. Anyone not know the difference between complex PTSD and PTSD? So complex PTSD refers to really early childhood trauma perhaps before the age of 2, definitely before the age of 5, because the architecture of the brain is done by age 2. It's very difficult to change it, some psychologists believe. And then by age 5, then the sub-architecture is done. So that's complex PTSD. So you may not have awareness of trauma, you just may have aversion to touch or certain kinds of experiences. And this would go back to pre-verbal trauma. I can tell you I've worked for the CAS, Children's Aid Society, for a long time. I consult with them, and much of the trauma happens the most vulnerable, babies. Babies are the most vulnerable for neglect, and then young children, and then it progresses from there. So treatment-resistant depression is a particular definition. So we use it for treatment-resistant depression, and the definition of TRD is an individual has failed 2 trials of an antidepressant medication. And it's not resolving. That's treatment-resistant depression. I find it really interesting that the patient gets blamed for drugs that don't work. It's your fault that you're resistant. It's not true at all. And then regular depression, which is chronic. A lot of people use it for eating disorders. I cannot say that I have expertise in that area, but there are other people that do. It is being used for eating disorders, definitely for pain, and for addiction as well. The way we use it in psychotherapy is we use a very, very low dose. We start you off very gradually, maybe 50 milligrams, go to 100, 150. We work a lot with first responders, so some of our guys are like 6'6" and 280 pounds. So we have conversations about that. So it turns out that the dose is not related to body weight and size. So if you go to a psychiatrist, they will give you based on your body weight and size. We won't do that. We will give you the medicine based on how defended you are. It's like, how scared are you to go inside and take a look at what happened so you can leave it in the past where it belongs? So we can have a very tiny person like myself and give them a higher dose, or we can have a really big guy and give them a much lower dose. So it's not based on your body size or weight. We will want to know, but we don't use it in that way. So the setting is therapeutic, it's not non-medical, it's a very beautiful environment. We have flowers, we have trees, we have comfy things for you, we use a weighted blanket and shades. The setting has to be very important. And one of the things that we do is we want you to create a setting of your own in your own private space, just some space that you can call your own. We ask you to create your own private setting as well. Providers of this service tend to be psychologists, social workers, clinicians that have quite a bit of training in psychotherapy. So I wanted to talk a little bit about myths of ketamine. Ketamine is not a horse tranquilizer. It is not a pig tranquilizer. It is a human anesthetic. It was developed after World War II, used extensively in Vietnam. It's on the World Health Organization's list of essential medicines. If you have a medical degree, for sure you know a lot about ketamine. Every doctor in the world is trained in this anesthetic. People feel that it's just a party drug, it's a recreational drug. It's not. We use it very responsibly and medically and psychologically for therapeutic purposes. There's a lot of hype in this area that all you have to do, it's a magic pill and it'll change your life. I'm here to tell you it's not true. You have to work very, very hard, especially if you come see me. I am a bit of a taskmaster, but we will change your life. It is a very self-directed plan, so you can work as hard as you want. You can take a deep dive if you want, or you can stay superficial. It's up to you. I can tell you, we have many executives and other people that our protocol is 9 weeks long, 6 weeks of journeys, and then before and after care. We have people that are taking short-term disability from work to take a deep dive into their own self-directed care. We really encourage that you take this time. You're not going to do it again, so take this time and go deep into your own self and just leave the past in the past where it belongs. You don't need to carry it forward into your future. And the more you put into it, the more you're going to get out of it, just like pretty well everything else. The K-hole is recreational use of ketamine. You take too much, it's not medically supervised, and then you start looping in an inner hell, and you can't get out. That's the K-hole. You get trapped into a trauma, and you live it over and over again. So I have never heard of it happening under medical supervision, so it's never happened to me, and we prep you a great deal so you don't enter into that nightmare loop that you can get into. Some people try and convince you that it is experimental. It's not an experimental drug. Off-label, there are not many studies. There are actually, by now, there's hundreds of studies talking about the efficacy of ketamine, depending on the indication. But it is not an experimental drug. It is on the World Health Organization's list of essential medicines around the world. The other thing about ketamine is if you do psilocybin, if you're part of a study or if you do it even recreationally, please be very careful if you're on an SSRI. If you're under medical supervision and you want to do psilocybin, we will wash you off your meds, whatever medication you're on. We need 2 weeks without medication because there are drug interaction effects. We don't have to do that with ketamine. So if you're on Wellbutrin, Effexor, or whatever, you can stay on your medication because it's very difficult to get off of these medications. So you can stay on your meds. We will give you recommendations about when and how to take your medications. It's also a myth that it only works for treatment-resistant depression. It works for what ails you, really, I think. Okay. So I mentioned that it's on the World Health Organization list of essential medications. It's a very, very safe drug. If you have a newborn baby, chances are pretty good the anesthetist that needs surgery, chances are pretty good that your anesthetist is going to use ketamine. It's a very safe anesthetic because it does not depress breathing. That's the danger with anesthetic. It suppresses your breathing, and ketamine does not do that, which I really like. So some people in addiction worry that ketamine can get you addicted. It is not classified pharmaceutically as an addictive substance like nicotine is, for example. But my view is anything that makes you feel good, you have potential for addiction, whether it's sex or gambling or relationships or food, whatever it is. We're addictive beings, and yes, you can't. So in that regard, it has addiction potential, but certainly not pharmaceutically, and certainly not if you are working with a trained provider. It's true that it's very hard work. We have a protocol where we ask you to do homework every single day. It's very self-directed, so you can spend 10 minutes or you can spend 2 hours. I've said that we have very, very many people that are just finding it really helpful to take time off work to take a deep dive into themselves. It is safe with other medications, and it has very rapid antidepressant effects. There are emergency hospitals in many places in the world that are, if you're suicidal, if you're having suicidal ideation or you are suicidal, you will be given ketamine, and it will just eliminate any suicidal ideation for 24 to 48 hours, which is enough time for your crisis team to get you linked up with services that you might need or family, that kind of thing. So it interrupts the suicidal ideation, but without treatment, that will come back. Ketamine also has multiple downstream effects, and we're just finding out about that. That's where I think the research is, well, what else can ketamine do? A lot of very cool things. So I do think that more research is needed so that we can find all the applications for not just ketamine, but all the medicines, actually. So I wanted to digress for a minute and just talk to you a little bit about dissociation. Anyone here not know what dissociation is? Everybody knows what dissociation is. So my favorite definition of dissociation is provided by Dr. Ruth Linus. She is at London Health Sciences Center. I follow her work. She's been a trauma therapist for, well, probably 30 years now. I've been following her for a very long time. And she says that dissociation is a normal phenomenon, especially when you're young. It's daydreaming. It's like you're sitting in kindergarten class or grade 5 and you're daydreaming. So it's along that same continuum. It is also a natural response to extreme stress. You essentially leave your body. Your consciousness leaves your physical body. And that's what we refer to as dissociation. Dissociation is a major alteration in your consciousness. Consciousness is very integrated at all times, and it fragments when you have a traumatic experience. So the way the brain processes information is you don't take in a traumatic experience all at once. The way in which the brain processes information is one part of your brain will take in a sound or sounds, another part of your brain will take in visual information, another part of your brain takes in movement, another part of your brain, so your brain takes in billions of bits of information, and no scientist, no one can in the world tell you how does it all come together, because your brain is processing shapes, movement, color, sound, fragmented information, but it all comes together as a gestalt, a whole in your consciousness. And that's what happens when you're traumatized. It just fragments. And that's why people who have trauma, even many years ago, you can be walking down the street and all of a sudden you feel unsafe. You've got a fragment of a trauma memory. Somebody's wearing the same color shirt as when you were assaulted. Someone has the same look on their face or their way, so you just really need a tiny fragment of your original trauma to activate the entire trauma. And this is, I think, I've been doing this work so long, this is what made it so hard to explain to insurance companies or employers. This person needs time off work because a very minor event can trigger a massive traumatic response. And so it's only been in the last, the 90s were the decade of the brain. It's only been in the very recent past that we're finding the neurological correlates of subjective human experience, my interest being in trauma. So because there is a failure of integration of internal and external sensory information, so internal information we call interoception. And interoception is what your brain does with all of the signals your own body is giving you. Exteroception is all the information your environment is giving your central nervous system. Everything that comes in, temperature, light, color, movement, all of that stuff. There's like 2 billion bits of information that hit the nervous system every second, and then your brain has to make sense of it. So when that is fragmented, you cannot process the memory. It just doesn't make sense to you. You'll have pieces of memory, like you'll hear a sound or something of that nature, but you don't have an integrated narrative of your original experience or your experiences. So when you have a traumatic event, regardless of how old you are, your body has from an evolutionary biology point of view, your body has a mandate to survive. Your body will survive even if you don't want to. Your body will force you to survive. And because of that, traumatic memories are not processed, and they essentially freeze in your body, and they stay in your body, and you can't get them out. When you are faced with a terrifying event, there's an involuntary, you can't control it. This is evolutionary biology. No matter who you are, you cannot contain it. Unless you're like a 40-year meditator or something like that, and you have enormous control over your interoception. People can slow their breathing down. Ninjas can do all kinds of things, but that's extraordinary training. Most of us, you and me, we can't do that stuff. So because this is involuntary, there are downstream changes in personality, in affect, in behavior. Maybe over time, you will start to become more and more withdrawn. I've done a lot of work with children, and there's, as an aside, I do think that the abuse of children is an epidemic. And because it's so unpleasant to talk about, we don't talk about it. It is out there. So the reason I bring this up is because you can have an experience. My other experience with children is that they don't tell their parents what happened. And you can be 7 years old or you can be 17 years old, and they don't tell their parents, and it's not about the parents. It's about all of the internal changes that go on. I had a young girl that was sexually abused at 13, and she didn't know what it was. She didn't know what was happening to her. And over time, her parents brought me in because she had gone goth. She had started dating guys 20 years older than her, started wearing black makeup, wearing all black, and they didn't know what was wrong. She was in a group home because she wasn't going to school, and when I talked to her, she had had this experience that she hadn't told anyone, and even when she told me, she didn't know what it was. She did not know she was being raped by her best friend's brother. So that's an involuntary fragmentation. You often don't know what's happening. So there's changes in behavior and affect, and you may not know what it was all about from back in the day. The fragmented experience persists because it is not processed by your entire consciousness. Over time, self and identity can change. That's complex PTSD. So I want to talk a little bit about the psychological effects of low-dose ketamine. These are the mind effects. So what it does when that default mode network shuts down, it opens a portal, you go into your non-conscious mind. It is like a dream. You can create anything you want, and this is where the change takes place. I did CBT for many, many years. There's no room for CBT. I no longer do CBT. I do very little talking, and in fact, I don't even really need to know a lot about what you are seeking assistance for. So it expands your consciousness when you're under the influence of ketamine. When you're under the influence, you can have an out-of-body experience. You can float out of your body. You may not be able to feel your body. You may feel unusual sensations in your body. You may say, well, I'm feeling something, but I've never felt it before, and I don't have a word for it. So you'll have unusual body sensations. Depending on what you're in for, you may have a life review. People talk about near-death experiences, and they have a life review. The ketamine journey, depending on why you come in, can give you a life review. You can go back in time and revisit happy memories. We just wrapped up last week with a lady who was convinced she has no happy memories. She was utterly abandoned by her family, and she wanted to journey and revisit all of that. And when she journeyed, completely surprisingly and unexpectedly to her, she had all of these beautiful, happy memories of her childhood with her grandmother that she completely forgot about, and that is what helped her reframe her. I had a horrible childhood where it was like, parts of it were horrible, but parts of it were really lovely. So that's what the journey showed her, that her entire life was not one of abandonment, that she in fact did. So that challenged her own belief system. You can journey inside and find your inner guide. I work very closely with you. We believe that you're the expert on your journey. I'm not the expert. I am the way shower. You're the expert on yourself. You have privileged access to the contents of your unconscious mind. I don't. Even if you wanted to tell me most of the stuff, you really couldn't. Most of the stuff that controls you does not have words to it. I think it's, I'm developing a theory that I think it's like an energy pattern. It's like code. You have to change the code. You can't talk to code. It's code, and it won't change, even if you talk to it. So you meet your inner guide, and you can ask your inner guide anything. You can meet a power animal. You can meet your childhood self. We can mentally time travel you into the future, where you can meet your future self. That's one of the things we ask you to do. We ask you, how will your life change? How do you want it to change? What do you want to change? Why do you want to change that? How will that make things better for you? So our process is very Socratic. I don't give you information. I excavate from your non-conscious mind what's going on with you. And the best thing I like to hear is, I don't know, because that tells me you're curious and you're open, and that's what we work with. We don't work with the ego. We work with your child self, because the child self is not damaged and harmed and contaminated by life experiences. So going back to childhood is a really big thing for us. You can re-experience an event. So when I was starting this work 5-6 years ago, people would actually go back and revisit horrible memories. I have evolved. I'm also evolving. And now you can actually reprocess a traumatic memory like a rape or an assault without revisiting it. You can delegate, compartmentalize that to another part of your consciousness, so you can process that while you are going to a ball game or having a happy memory. There are multiple consciousnesses that we can access, and it's really limited by your own imagination. If you think you've got one consciousness, you got one consciousness. If you think you've got an infinite number, you've got an infinite number, and you can access them. You're limited by your belief. So we ask you to become very childlike, because children believe in all kinds of things, and it turns out, from my point of view, it's true. Adults are the ones that have these constraints. You can meet other beings. I have a person that I've been working with for a very long time. He had an electrocution injury, a brain injury, and a frozen shoulder, and his hand was in a claw like this for 22 years. And then he got permission to get some ketamine going, and he can now do this for the first time in 25 years. He had probably about a year of infusion, ketamine. I worked with an anesthetist, and he said, "Oh, Dr. D, please don't tell WSIB. I don't want them to know I'm getting better." And I said, "Don't worry, secret's safe with me." So he's absolutely getting better. When he journeys, how he got better, he met beings from other planets and other dimensions, and they took him inside his brain and showed him what he needed to do. So it wasn't me, it wasn't the medicine, it was some aliens that he met, and this alien has been with him for this whole time. He's got a name from him, they're good friends. The other thing is that, if you went to a regular psychologist and told them you were meeting beings from other planets and they were telling you about your brain and take you into the brain, they would send you to a psychiatrist and they'd put you on Haldol. But I don't do that because I get it, because I had my own life event that sent me to Mexico to wake up. So now I get it. So if you tell me now, "Yeah, so I had this visitation last night," I'd say, "Oh, tell me about your visitor." I wouldn't say, "Let's schedule you with a psychiatrist." I practice completely differently now. When you do go back, I am now finding that you don't have to re-experience your trauma. You can let another part of you do that trauma thing, like that part of you that's resourced, that can handle it. So I do a dissociation within a dissociation within a dissociation. It's very cool what we can do with once you open up into your consciousness. We don't work with ordinary consciousness. I could talk to you till the cows come home, and it wouldn't change. It wouldn't convince you of anything. You have to go to the causal level. The causal level is energetic. It's deep in your consciousness. If you do go back and revisit a terrible memory, you will have emotional distance from it. Not only will we teach you how to get emotional distance from it, we teach you how in expanded state to change your experience. We change your childhood experience, which then changes your future. Can you understand that? Does that make sense to you? You have to change your past to change your future, and that's what we help you do. It's very cool work. And then because there's also plasticity, now you have these neurons talking to each other that weren't talking to each other before. And so you may come back saying, "Oh, maybe I'm not such a horrible person. Or maybe I don't need to feel ashamed because that person did that to me." So you think differently. You come back with more information and you bring it back. The reason I like low dose is if you go IM or IV, they base it on weight, you don't remember anything. There is the plastic effects, so you do get better if you have pain. It will help you a lot with your pain. A lot will be helped. I'm not dissing it in any way, but you won't bring the knowledge back. That's where we come in. You need to know. You need to bring it into conscious awareness. You need to extract it, excavate it out of your non-conscious mind into conscious awareness. You have to turn it into language. It's a very similar process with when people are born deaf. They can't speak well because the brain has to have a circuit where it goes out of your mouth, out of your consciousness, and go back into your brain through auditory information. And when you can hear yourself speak, you can articulate well. But if you can't hear yourself speak, your articulation will be underdeveloped or it won't be as clear. And this, I believe, process is the same. It's really important to me to find the patterns here in other areas of science. And so that's what I do. I link it to other areas of where else are researchers or therapists seeing this. And then the integration process is we come back. So you may come back saying, there was this tree, and this tree kept trying to talk to me. What was that about? Then we go back and have a conversation with that tree, because that tree could be your guide. You don't know. We don't know. So These are the physiological effects of low-dose ketamine. There's sensory effects. You may feel, my body is so heavy, I can't move my body. Why is my body not moving? We prep you. People say, why do I have to spend 2 sessions prepping with you? It's so that you don't freak out when your body goes numb. It's so that you don't freak out or have a panic attack when your body starts melting. These things happen, and we have to teach you. This could happen to you. Don't worry. We have a safety protocol. It's all good. But you have to know so that your brain will get upset with anything that is new, novel, or unfamiliar. So we tell you all this stuff so that your brain says, oh, yeah, I remember this. Dawn said that my body could go numb. It's going pretty numb. So then you won't get upset, because it's familiar to your brain. So we prep you really, really well. You may have a distorted sense of time. You may have a distorted sense of space as well. Most people say they feel very calm. Everyone says they feel very calm and very relaxed afterwards, which is one of the effects we really like. You may have novel sensations. You may see novel beings. You may have a tree talk to you, or an insect may want to make friends with you. You'll have novel experiences, and we want you going in with as a child, like with wonder and awe and curiosity about what is this praying mantis doing talking to me? We'll have a conversation, because that's your power animal. So we teach you all these things. There is an inner detachment. It's like watching a movie. You can watch a really scary movie, but you always know it's a movie, even though your heart is racing and you're breathing and you're getting all aroused over. You know always that it's a movie. And it's the same with this. You know you're in a journey. We do have a nonverbal signal. We know that if you are having a tough time, we may not know. We have a nonverbal signal. If you need our assistance, you put your hand out. Somebody will come sit with you. 2 of us are with you through the whole journey, the 3 hours. We will not leave you. And we won't let you leave either. You can't go anywhere. I take your shoes. So it is like a waking dream. So it's like having a dream, but if you have a scary event, so we will teach you how to deal with that scary event. And mainly what we teach you is lean in, face your fear. We'll give you all the tools you need to face your fear. But if you run, your fear is going to chase you. That's it. So the CAP process is with our clinic, and I think probably most clinics that do this work. There are some eligibility criteria. Ketamine isn't for everyone. There are some indications that we don't provide ketamine for, not because it's not indicated, but because there isn't enough research on it. So we're really big on safety. So there are some things like bipolar disorder, although I have done that. I have done somebody with bipolar disorder, and it worked brilliantly. We will not give you ketamine if you are pregnant or nursing. So that's an exclusion criteria, because we just don't know what it's going to do to your body or what it's going to do to your baby. So we just ask you to wait. And so that's an example. So there is a medical assessment. We do send you to our prescriber. You will get either in-person or online medical assessment by either our nurse prescriber, nurse practitioner, or a medical prescriber. There is a psychological screening. So I do not do what I used to do back in the day, but I do want to know what are the symptoms that are troublesome for you. I don't pay attention to diagnosis so much as I do to what's going on with you that you don't like and you want to change. So the medical assessment, psychological and psychiatric, if you need it. Sometimes we need it for funding purposes. Then we give you, once we have your data in, we will give you feedback and prepare you. We establish the set and the intention. We will absolutely, you can't take a journey unless you can tell me, why do you want to take this journey? How is this going to help you? How is this going to change your life? And I don't do it to irritate you, but I do it to get you to excavate your own thinking. Think. That's why we do that. We recommend 6 journeys. Although having said that, we've had people finish in 2. And on one occasion, I had one gentleman that's finished his 6 and said, I have unfinished business, and I want to do another journey. So he's the only one. We finish in 6 sessions, and you're good to go after that. So when you come in for your journey, we will set you up with we talk with you for about, journey's 3 hours. We talk with you for about an hour, getting your intention. That's the secret sauce. You have to know the intention. It's like your roadmap. It's your blueprint. You can say, I want to go from Toronto to Montreal, and you could randomly head out east and eventually end up in Montreal. But if you have a detailed plan, you'll get there in record time. So that's what we do. We make the blueprint for you in the intention setting. And then after the journey, you journey for about an hour or so, and then at the end of your journey, we'll bring you a big bowl of fruit. We help you get to the washroom. You're still a little bit wobbly. Some people are dizzy for a while. Other people just go for a walk afterwards. It's very different. So we spend an hour integrating that journey, and then based on the integration, we do a match. Did your journey give you your intention? Did you get what you wanted from your journey? We need to verify that. And then we have, okay, I give you a lot of homework. Every single day I want you to pay attention to yourself, and we have a pretty detailed self-care protocol around that. It's a big investment of time and funds and money and energy and all kinds of things. So I just think you should get the biggest bang for your buck out of this, and the way to do that is to pay attention to yourself and take good self-care. So in preparing for a safe journey, I do recommend everyone should have a medical assessment. Make sure if you have untreated hypertension, a bladder infection, it's really important to be safe. Just go get a medical assessment. It's just part of our protocol. And then the psychological screening, we thoroughly prepare you to manage inner states. So we teach you ordinary state skills. So that's like breath work. I'm sure you've heard a lot about breath work. We teach you to down-regulate your your stress. We teach you the subjective units of distress scale, so you quantify your own level of distress. We teach you a methodology for tracking your own distress, knowing if you're better or you're not better, and what to do about it. So we're pretty behavioral in that regard. You have to know the purpose, and you have to specify the intention for each journey. You have to follow all flight instructions. So before your journey, we will send you a document. It's called flight instructions, and that's all the things that you need to do to prepare for your journey, including, don't eat 2 hours ahead of time before your journey, get a good night's sleep, and everything else that you need to do. We do require you to be chaperoned for the journey and the plastic effects. So I got 2-minute notice here. So before your journey, the set is very important. The set is your mindset, and we teach you expanded state skills and ordinary state skills. Expanded state skills will be how to mentally time travel. We'll teach you how to go into the future or the past. We'll teach you how to manipulate your dream environment, because you can do that. We can teach you to go to another planet if you don't like what you're seeing on this planet. It's quite interesting. The setting is calm and peaceful. You can bring in your meaningful transitional objects in order to have a successful journey. Do let your intention guide you. We will encourage you to lean into your distress. Lean in. Go find out why your fear is chasing you. Stay curious, trust yourself, welcome everything, and let go into surrender to the journey, and let the music carry you. We do curate a beautiful playlist for you for each journey, and each journey is designed to take you deeper and deeper and deeper into your states. Don't make judgments. If we know that the default mode is kicking in, if you start, is this real? I don't know if this is real. Like if you start talking to yourself, that's your default mode leaking in and contaminating, and we ask you not to make judgments, and be aware if you are. Don't rush through the process. Take your time, go slow. We're really big on go slow. Don't resist what emerges. So if your demon emerges, we ask you to have a conversation with your demon and ask the demon what he wants, or what's the monster want with you, and have a conversation, and you will have the resources to do that because you won't be scared, because that part of you that's scared is shut down. So don't let your ego take over. Don't journey fatigued or stressed. If you had a bad night, just give us a call and let us know. We don't want your journey. It's not good. We want you calm and relaxed. Each journey is very unique. It will give you what you need and not what you want. We want you to trust the wisdom of your own inner self. You are the expert on yourself. And how you unfold your journey will depend a lot on how you are wired and how you think about it. Dosing is graduated. We start with 50 milligrams, 100, 150, 200, most people find 150 milligrams a sweet spot. Some people want to go to 350. A lot depends on how defended you are against your drug. So we work with you to establish that. Each journey will have a different intention. Each journey has new insights with cumulative effects. We want you to integrate so that you can cultivate your inner superpowers. Mental time travel is a superpower. Really get used to doing that. There's so many things you can do in an expanded state that are causal, that are really, really helpful. We ask you to go inside and find out what is the friction, what is stopping you from doing whatever it is that you want to do. We help you identify your friction and discover non-conscious barriers. We want you to make better sense of your past so that you can change your future. We want you to link your journey with your intention. This increases your awareness, so you generate your own answers. Only you can come up with your own answers, right? My answer for you is maybe not the best answer for you, but if it comes from inside of you, we encourage you to trust yourself. We want you to cultivate a kinder, more compassionate relationship with yourself. I've spent a lot of time with depressed, traumatized people, and they're not kind to themselves. They're very mean to themselves, and we really want you to be more kind to yourself and more compassionate to yourself and make intentional choices and decisions. I'm out of time, unfortunately, so don't have to go into this, but we have this is our signature self-care protocol. It's integrated into the entire 9-week protocol. It strengthens the new connections that you have made in your journey. It is very self-directed. It's organic and holistic. It emerges in real time. And we do provide you with resources, a journal to track your progress. The aftercare, we want you to develop nourishing self-care routines. We want you to incorporate whatever you've learned about self-care into your activities of daily living. We just finished working last week with an executive who wanted to be less anxious and stressed in his meetings and sales and stuff. And he did really well. And he said, oh, by the way, I quit smoking. And I went, I didn't even know you smoked. I didn't know that was an intention. It wasn't an intention. He just said, yeah, I just kind of listened to my body like you said, and my body said, yeah, I don't need that. He quit smoking 3 weeks. Very proud of him, and that wasn't an intention. That's a downstream effect. That's what I'm talking about, downstream effects. You have to remain self-aware, and we teach you how to take care of yourself in real time. That's the secret sauce. Make intentional choices and decisions. Become self-directed. This is just repetition, life after CAP. You will think in a new way. You will be a new person. You will take the ketamine will take the power away from disturbing memories if they don't disappear altogether. I was telling someone we had a woman who was sexually assaulted in a New York subway, and she had terror. She didn't leave her house for 10 years. She was going to go to law school. Didn't work, couldn't go to school. So she came to see us, and I told her, have a conversation with your terror, and she did. And she found out that her terror was terrified. So we sent the terror on a vacation to her parents' condo in Miami. So her terror is now reading a romance novel at her parents' condo in Miami. 2 weeks after her journey, one of her intentions was, I want to leave my house. She booked a trip to LA with her girlfriend. She hadn't left her house in 10 years. She's in LA 2 weeks after wrapping up with us. That's a fabulous downstream effect. So the feeling goes. That's my acid test. They will say, it's no longer with me. My fear has left me. My terror is in Miami. These are the metaphorical things that we hear all the time. You have an expanded perspective. You can maintain calmness and relaxation. Creative solutions emerge for you. You're empowered. You have less stress in your body. Mainly, you're kinder to yourself, which really helps. Slow yourself down. So we are inclusive. This is Julian and his human in an actual ketamine journey. I have a developing interest in animals and how they react to people undergoing journey. Julian really wanted me to stop because he could feel her energy being released. And he was like climbing on me and licking me. And so finally he went to stay with his human. All right, this is us. Please visit us downstream. We're pretty fun. We're pretty friendly. We do good work. Come and see us. And this is how you can contact us. And thank you. It's been an honor. Gracias.